In today's video, we will explore the connection between a ketogenic diet and type 2 diabetes. Specifically, we will take a closer look at an intriguing study on how a low-carbohydrate ketogenic diet, or LCKD, can be used to manage and potentially improve type 2 diabetes. But before diving into the details of the study, let's start by understanding what a ketogenic diet is and how it works. The ketogenic diet is a high-fat, moderate protein, and very low-carbohydrate eating plan that shifts the way your body gets its energy. Normally, our bodies rely on carbohydrates like bread, pasta, and sugar for fuel. But on the keto diet, you dramatically reduce carb intake, which forces your body to switch gears and start burning fat for energy instead. This process called ketosis is what makes keto so effective for weight loss and other health benefits. When you cut down on carbs, your body's insulin levels decrease and your blood sugar levels stabilize. This is especially beneficial for people with type 2 diabetes, as it can help improve insulin sensitivity and blood sugar control. As your body adapts to this low-carb state, it starts breaking down stored fat into molecules called ketones. These ketones then become your new source of energy. Instead of glucose from carbs, your body now relies on ketones, which are produced from fat. Now, let's dive into a condition that affects millions of people worldwide, type 2 diabetes. Type 2 diabetes is a chronic condition that occurs when your body becomes resistant to insulin or does not produce enough insulin to regulate blood sugar's level. Insulin is a hormone that helps the body use sugar, glucose for energy. But when the body becomes insulin resistant, the cell stops responding to insulin. As a result, sugar builds up in the blood, making it harder for the body to use glucose as fuel. While there isn't a single cause for type 2 diabetes, there are several factors that can increase the risk, such as being overweight, living a sedentary lifestyle, and having a family history of diabetes. These factors can lead to insulin resistance, which means your cells don't respond well to insulin, causing glucose to remain in your bloodstream instead of being used for energy. Now, let's take a look at some actual research that supports the potential of the ketogenic diet in managing type 2 diabetes. This study was conducted by Dr. William and colleagues, published in Nutrition and Metabolism in 2005. The research explored how a low-carb diet may improve blood sugar control and reduce the need for diabetes medications. One study conducted with 28 overweight participants with type 2 diabetes explored the effects of a low-carbohydrate ketogenic diet over a 16-week period. Participants in this study received counseling on how to follow a low-carbohydrate ketogenic diet, starting with an initial goal of less than 20 grams of carbohydrates per day. At the same time, their diabetes medication were adjusted or reduced. Over the course of the study, participants were monitored bi-weekly for measurements, counseling, and further medication adjustments. The results were striking. Hemoglobin A1C, which is a key indicator of the blood sugar control, decreased by 16% on average, from 7.5% to 6.3%, which is a significant improvement. In fact, 7 participants were able to completely discontinue their diabetes medications, while 10 others had their dosages reduced. Additionally, participants lost an average of 6.6% of their body weight, which is another positive outcome. Fasting serum triglycerides, another important measure of metabolic health, also decreased by 42%, showing the broader impact of the diet beyond just blood sugar levels. This study suggests that the ketogenic diet can be a highly effective strategy for improving glycemic control and reducing the need for diabetes medication in people with type 2 diabetes. However, it is important to note that because the diet is so effective at lowering blood sugar, patients on diabetes medication should be closely monitored by a healthcare provider, as medication adjustments may be necessary. So, this research adds weight to the idea that a well-managed ketogenic diet could play a pivotal role in managing type 2 diabetes and in improving overall health outcomes. Thank you for watching. I tried my best, so if you like it, let me know. If not, let's pretend this never happened.